In creating a toilet training plan, there is no one-size-fits-all program for your kid because each child is different. Is your kid more of a talker, or is he or she a doer? Does your kid like adult-imposed rules and regulation, or is your toddler more of an independent soul? Well, you should figure it out, mom and dad, and enjoy the process of getting to know your kiddo as well. In this video, we will talk about the tools that you would need in creating a toilet training plan. We will also talk about when is your child gonna be ready, or what are the instances that you should put off toilet training, what are the two types of potties, and some tips for you to help with toilet training. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Creating a toilet training plan. We will talk about the tools that you would need in creating a toilet training plan that would be individualized for your kid and to implement it at the best time when your child is ready. First tool, be positive. Children learn better when they are praised rather than when they are punished. So even if the process is gonna take a while, gradually, in small, tiny steps, then still give your child a praise. When your child has done a good job, give him or her a hug, a praise, or perhaps a small reward. And when your child has failed, then let him or her know that he or she can do better next time and help them clean up. Next tool, you have to be consistent. Be as consistent with your child's bathroom routine as much as possible. So you should put the potty in the same place every day. And in terms of the sequence of events, they have to be consistent as well. For example, after your child has eaten breakfast, then your kiddo goes to the bathroom and to sit on the potty to have a bowel movement, and then wipe and then wash the hands. So keep this routine as consistent as possible and should be the same for other caregivers as well. Next tool, be involved. Your child's abilities, behaviors, and needs may change frequently, and they can be unpredictable as well. For example, your toilet training technique, which has worked 2 weeks ago, may not work today. Or if your child has mastered a certain skill, when faced with new problems, this might temporarily disappear. So don't worry, just stay involved so that you can monitor your child's bathroom techniques and you can identify new problems that might arise. Next tool, have fun. Well, toilet training can be difficult, but it can also be fun. Don't let your child's fears, resistance, or hesitations too seriously. Just think about it. Almost every kid learns how to use the toilet eventually. So if you're having a hard time, just take a break and just enjoy those funny moments. Now, when will your child be ready to use the potty? Rather than basing it off on age, look for signs that your child is ready. Some of these signs include if your child can follow simple instructions, if your child can understand and use words to express himself or herself, if your child can make the connection between the urge to poop or to pee and to use the potty, if your child can keep the diaper dry for 2 hours or more, if your child is able to get to the potty, sit on it long enough, and get off the potty, if your child is able to pull down his or her diaper or pull down his or her underpants, and if your child shows interest in using the potty. Then, there are also instances where you need to put off toilet training, and these instances include if you're traveling, with the birth of a new sibling, if your child is changing from crib to bed, if you're moving to a new place, or if your child is sick, especially if diarrhea is a factor. How long will toilet training take? What are the two types of potties? And what are some tips to help with your toilet training? Well, before we go to that, are you expecting a baby? Or you already have a newborn? How much better life can be when things are under your control upon baby's arrival, where you feel confident about breastfeeding, when you know how to soothe a crying fuzzy baby, when you feel more rested because you understand baby's sleep schedule. How about you get the training in the comfort of your own home? Well, I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. So now, how long will potty training take? Well, usually it can take 3 to 6 months, but of course, it depends on each child. If you start too early, it might take longer. And it might also take several months, even years, to master staying dry at night. There are 2 types of potties. The first type is a standalone toddler chair with a bowl that you can empty onto the toilet. The second type is a potty seat that you put on top of the toilet, where your child can feel more secure and not fear falling in. If you choose the second type of potty, make sure that you provide a stepping stool so your child can reach the seat comfortably. It is also helpful that you provide a potty on each of your bathrooms, and you can keep it in the trunk of your car as well in case of emergencies. If you're traveling long distances, it is helpful that you take a stop every 1 to 2 hours. Now, if you've decided that your child is ready to use the potty, good, let's go. Here are some of the potty training tips for you. First, set aside time to devote to toilet training. Second, do not force your child to use the potty against his or her will. And then third, show your child how to use the potty. Children learn better by watching you. In fact, you can have your child sit on the potty while you use the toilet. Some other tips for you? Well, establish a routine. For example, have your child sit on the potty after waking up with a dry diaper. Also, have your child sit on the potty just a few minutes, a couple of times each day, and allow him or her to get up if he or she wants to. Also, have your child sit on the potty 15 minutes after a meal to take advantage of the body's natural tendency to have a bowel movement after a meal. And also, if your child is clearly showing signs of using the bathroom, have him or her sit on the potty. These signs include crossing legs, squatting, or grunting. Also, avoid clothes that are hard to get off. When your child is toilet training, he or she should be able to undress himself or herself easily. You can also offer small rewards or stickers whenever your child has done a good job. And keep track of your child's progress. Also, everybody, all caregivers, should follow the same routine and use the same approaches or techniques in potty training your child. Children learn best when they are praised, so praise your child on all his or her attempts at potty training. Remember, accidents may happen, but do not punish your child for this. Instead, reassure him or her that they are on their way to using the potty like a big kid. Is your child having some toilet training problems? Remember, kids might have accidents or might have trouble in times of stress. For example, your kiddo might have a new sibling and may start to have some accidents. But if your child has been potty trained and is now having some regular, frequent accidents, then talk to your doctor about it. You should also worry and let your doctor know if your child is 4 years old and is not potty trained yet. Hey, if you liked this video, watch my other videos where I teach you about other child health problems.